Actually, if we just talk about blood and topics related to blood physiology, as well as the topics which are high yield and can be asked in any anesthesia exam, whether they are written or oral, as a long case or a table viva. Okay, so I will just try to have some idea about it. So one of the topic which is very important is anemia, and it is a very high yield topic because it's being asked multiple times. So here I have chalked out some of the questions. Okay, you can have a look on it, and if, because the theory behind sending these questions is that if you know your enemy, you can prepare yourself for that enemy. Okay, so these are whatever questions which are being which can be asked with reference to anemia types, how to identify, how to correct, and if you know these answers, it will be easier for you to predict the questions, because whatever anemia is whatever type of anemia is, whether it is sickle cell, whether it is any nutritional deficiency anemia, the thing which is at the other side of the story is the same. That is the effect of anemia on the body, whether it is compensated or decompensated. And again, whatever the cause is, the topic will be that you can, if the surgery or the patient condition allows you to correct it or not. Okay, so this will be the basic theme. And then, being an anesthetist, what is the important thing is that if you have an anemic patient and it is like, even if it is compensated, there will be some compensatory mechanisms which will have drastic effect on your anesthesia management. Okay, so you can have a look. So this is one of the topic, so you can have a look at it. And then the next thing which will be related to it is the how to deal. So there will be certain maneuvers, like you will be arranging the blood, you will be using tourniquet, positional strategies, as I have mentioned, dilutional strategies like normovolemic or hypervolemic hemodilution. Okay, and you will avoid stress. Like, it will be a whole package which you will be doing. Okay, so you can have a look at it. Then the similar topic which is related to it is blood conservative strategies. Okay, this can be asked separately, but most commonly it will be asked with reference to either a bleeding pregnant patient, obstetric patient, or a bleeding trauma patient, or anything like that. Okay, so but the things will be the same. So these are the questions which I have made for autologous and homologous, and complications when we donate 1 pint of blood. What are the products which are formed from it, and how they are stored? This question may be asked as a in a OSCE, or it can be asked in your long case, or these knowledge can be there in a number of places. Okay, so this is even these questions are coming in the MCQs, about the storage at sol or CPD or things like that. Okay, so this is one of them. Another topic, you can have look on some of the questions about it. You will find the answers in internet and in the articles folder which I have just recently shared. So these will be then some of the topics with reference to coagulation. Okay, because coagulation, anticoagulation, platelets, role of platelets. Okay, and then how you identify a problem. So the diseases which will be related to coagulation defects or hypercoagulable state will be either in the form of hemophilia. Okay, von Willebrand disease. Then there may be thrombocytopenias, ITP or TTP, or then maybe dilutional coagulopathies. Then maybe the things which are related to what is that? DIC. Okay, the role of FDP is D-dimers. What is ACT? What is APTT? What is PT? What is thrombin time? What is clotting time? What is bleeding time? You should be knowing things about it. Okay, as well as the role of thromboelastography or ROTEM in first of all identification, that how you need to treat the cause of bleeding, and how to like quantify, how to call it, like this is a whole package which you should be knowing. What is the role of tranexamic acid? When will you give cryoprecipitate? When will you give FFPs? When will you give this prothrombin complex concentrate? So these are the things which you should be knowing. Yes, in some basic sciences exam they can even ask you about even in the long patient people going for long case, they can ask about coagulation pathway. They can ask you about extrinsic, intrinsic, and then the new not new but relatively different theory, alternative theory of coagulation, that is cell-based initiation, amplification, and propagation. Okay, in which there is a role of factor 7 is very important. Okay, so these are the questions which I have just prepared, and you can find the answers. Even if I find a volunteer who can solve these questions and share, it will be a great effort. Okay, so some of the things will be reference to risk of thromboembolism. Okay, how to identify the risk and how to give the thromboprophylaxis and how to treat an event of thromboembolism. Okay, so then another question they can ask you is with reference to factor 8 and factor 9, how to replace it. Okay, with reference to vulnerable disease, what is the role of desmopressin, what is the role of cryoprecipitate, how to manage it. Okay, coagulation changes in different scenarios. You can have a list: coagulopathies in liver failure, coagulopathies in pregnancy, coagulopathies in overtransfusion, coagulopathies in any scenarios. So okay, because actually in this way it is not written in the books, unfortunately, and because majority of people are still in habit of reading books and only following the books, that's a big issue. Unfortunately, nobody because it needs a lot of energy to even convince you to study in that way. Because I receive messages when I send these questions: sir, from where we have to find the answers? Sir, do you have the answers? So come on, my dear, you are not in class 5 that I will give you happa food and then I will make sure that you are eating or not. No, you are smart enough to find the answer. That's not at all a problem. And if you want the source, the articles folder is the source. Okay, so fibrinolysis, antifibrinolytic medications, these are what is the role of NSAIDs, aspirin, and mind it, I never recall the word, but you should be knowing the classification of anticoagulants, classification of antiplatelets, different types, and of course another topic will come here, will be HIT, heparin induced thrombocytopenia. It can be asked in table viva. It can be asked with reference to whenever you are using heparin anywhere, even if you are using heparin in the fluid for arterial line, even that can cause, because sometimes you are not sure how much heparin the anesthesia technician has put it. So that's why in majority of centers they don't put heparin. They don't use heparin. They only use the flush and the pressure. Okay. So another topic which will be important is with reference to regional anesthesia and anticoagulants, antiplatelets, when to give, when not to give, when to perform a block, if the patient is on anticoagulants, what will be the danger signs, you should not give it, how much platelet count it should be, how much time should be elapsed for different anticoagulants. So this is a very high yield topic and you should prepare it pre-hand. Again, I request you. Okay, so antiplatelets will be there in patient with cardiac interventions, or the patient is on any warfarin, patient is on warfarin, patient is on any other novel antiplatelets and anticoagulants. Okay, so you should be knowing the common, you should be knowing what, if they ask if your patient has HIT, which anticoagulants will you use. Okay, if you want to reverse, how to reverse it, how much the duration of different. So this is very important. So I will suggest all of you to have a look at it, because practically whenever we just open the Google and we can find the duration, but for you should be knowing. Okay, So this is with reference to venous thromboembolism. Okay, so like that's it. You know, sickle cell disease, thalassemia, hemoglobinopathies, cyanide poisoning, methemoglobinemia. You should have a bit of information, say like cyanide poisoning with reference to, for example, nitrates. So you should be knowing what happens in carbon monoxide poison, like hemoglobinopathy and oxygen transport. You should be knowing as a basic science. They can ask you how to calculate the oxygen content, oxygen flux, oxygen delivery. They can ask you in a long case even. Okay, so you should have some information about it. Okay, and then what is the role of hyperbaric? What is the concept? It is with reference to the dissolved oxygen. It increases the partial pressure, and then it has some effect on the dissolved, because in carbon monoxide poisoning, actually the hemoglobin is displaced, and the normal pulse oximeter is not able to identify it. So saturation may be 100% and patient will be cherry red color, but actually the tissues are denied of oxygen, because hemoglobin is the car on which the oxygen is transported throughout the body. Okay, so you should having some information about porphyria, what drugs are safe, what drugs are unsafe, which are common, like few words about the topics, types of porphyria. Okay, which type is important. So I have just like you can have another topic which is not common for UP guys is cell saver. So you should be knowing how to use the cell saver, what are the indications, what are the and it's not difficult. You will find a good article on cell salvage, so you can have a look at it. Okay, so that's it. Thank you very much all of you to listen this, and I hope that this charred West score, if any topic I have missed or any point I have missed, please do let me know, and feel free to drop a message to me, and I will be very happy to answer. Thank you.